Why does your knee hurt when going up and down the stairs? Many people notice that flat walking feels manageable, but stairs suddenly feel uncomfortable. This can result in, for example, a dull ache, sometimes a sharp twinge, we've all had them before. Sometimes the knee just feels unstable. This is very common even without an injury. Stairs simply place different demands on the knee compared to flat walking. So why are stairs harder? Flat walking is predictable with consistent load. We do it all the time, every single day. Stairs increase demand on the knee. Going upstairs, for example, the knee lifts the body weight and more muscle effort is required. When you go downstairs, the knee controls body weight whilst lowering. This lowering movement requires more strength and control. So why does going downstairs sometimes hurt people more than upstairs? Many people notice their knee pain is worse when they go downstairs, and this is because the knee must control the lowering movement and manage body weight smoothly. If control is reduced or the knee is irritated, more stress passes through the joint. Now, this is why going downstairs often reveals discomfort first compared to going upstairs. Stair-related pain is often linked to fatigue, or the knee is just struggling to control the movement smoothly. It's not necessarily an injury, so there's no need to panic just yet. When the knee struggles to manage load smoothly, the pressure increases. Over repeated stair use, this can lead to soreness, irritation, stiffness. So frequent use of stairs usually reveal any issues in the knee early on, and that's because they require more strength, control, and load tolerance. They highlight issues that may not appear during flat walking, for example. Now, this doesn't necessarily mean damage, it just means there's an increased challenge for the body to work with. So let's talk about managing load on the stairs. You don't need to avoid stairs completely. Instead, here's some tips. Take stairs more slowly, use a handrail if it's there, and limit unnecessary trips during flare-ups. These small changes reduce stress while may reduce stress while symptoms settle. You can then gradually increase stair use again. So, is there any exercise that helps? Improving movement and control can reduce stair pain. So let's talk about controlled step downs because they're very useful. So how do you do it? So stand on a low step or the bottom stair. What I want you to do is slowly lower one foot to lightly tap the floor, then go back up the step by pushing through the standing leg. So what I want you to do is focus on slow movement, staying controlled and not dropping quickly. Make sure you start low and use support if needed. And you can progress the exercise by reducing how much support you use. You can slow down the movement even further than you was already doing. You can increase the number of repetitions. So if you was doing 10, you can then do 12. And you can hold the sort of tap button where your foot taps down the floor. You can hold that for a longer period to increase the time and attention. Some people do use knee supports during flare-ups, and that's absolutely fine. They can improve confidence, they can provide reassurance, or you could use more of a targeted approach like a patella strap. But these supports should assist movement and not replace strength. If stairs cause soreness later, like later in the day, make sure you allow adequate rest, space out your activity, and consider cold therapy like ice wraps or something like that. They can help calm the irritation. I love them all the time, use them every single day. Okay, so to summarise, knee pain on the stairs is very common and it often relates to increased load, fatigue, and reduced movement control. So with sensible load management, controlled exercises and recovery, comfort and confidence on stairs can improve over time.